This is my student support system. Keep watching, keep learning.
Hello, good evening students. In today's class of midwifery, we will discuss an important topic, Hyperemesis Gravidarum. This topic is included in the chapter Common Pregnancy Related Disorders and their Management. So what is Hyperemesis Gravidarum? Actually, nausea and vomiting are common symptoms of pregnancy, as you know, affecting approximately 70% of women, with the onset from 4 to 8 weeks of gestation and lasting until 16 to 20 weeks. So this is normal. But sometimes severity increases, okay, and this form is called hyperemesis gravidarum. So what is hyperemesis gravidarum? Hyperemesis gravidarum is the severest form of this nausea and vomiting or morning sickness in the pregnant ladies and occur approximately 3.5 per 1000 population. The woman present with history of vomiting that has led to the weight loss and dehydration. So, in other words, we can say that excessive vomiting during pregnancy leading to dehydration, electrolyte imbalance, ketosis and weight loss of more than 5% of pre-pregnancy weight. It is the proper definition of hyperemesis gravidarum. What are the causes and risk factors? Actually, the nausea and vomiting which may lead to a hyperemesis gravidarum, the main causes are same for both. Number one, increased HCG level, hormonal effect, increased estrogen and progesterone level, sometimes psychological factors such as stress and anxiety, and infection of Helicobacter pylori bacteria. And risk factors include first pregnancy, multiple pregnancy, molar pregnancy, history of HG in previous pregnancy or hyperemesis gravidarum in previous pregnancy, and obesity. So these are the risk factors leading to hyperemesis gravidarum. What clinical manifestations we can see in this case? Severe and persistent vomiting. So when a lady feels severe and or experience severe and persistent vomiting, it means that she is suffering from hyperemesis gravidarum. Inability to tolerate food and fluid, which leads to weight loss, 5% pre-pregnancy weight, more than this. Signs of dehydration such as dry mouth, low blood pressure, tachycardia and oliguria. Electrolyte imbalance symptoms may occur like muscle weakness, confusion and ketotic breath order. So these are main clinical manifestations. So what diagnostic investigations are done? Urinalysis, which includes ketone and specific gravity, blood test, electrolytes, renal function test, liver function test like liver enzymes, thyroid function test, ultrasound to exclude molar pregnancy and multiple gestation. What are the complications? If this hyperemesis gravidarum is left untreated, severe dehydration may occur, hypervolumic shock, the lady may go into shock, electrolyte imbalance may occur, which may lead to arrhythmias, Wernicke encephalopathy, even renal failure and fetal growth retardation or restriction or preterm labor or birth. Now, how we will manage this? So, medical management includes anti-emetic drugs such as ondansetron, metoclopramide, promethazine. Vitamin supplementations, especially thiamine, nutritional support, nasogastric tube feeding, parenteral nutrition if needed, and if severe form is there, then hospitalization may be needed and IV fluid replacement, normal saline or with potassium, it may be needed. What are the nursing management or important points which as a nurse or as a midwife we should keep in our mind? In assessment, we will monitor the vital signs, weight of the lady, fluid balance, and urine output. In intake output balance, will check if the client is admitted. Check for dehydration, electrolyte imbalance, and then main intervention includes maintain NPO initially, then reintroduce clear fluid. Later on, small frequent meals if the fluid is tolerated. Then we should keep in mind to avoid strong odors and greasy foods. Emotional support and reassurance is needed, support from family also. And then we will provide health education to patient and family regarding small and frequent meals, avoiding triggers such as strong smell or spicy foods, keep the client hydrated, rest and stress reduction, and early reporting of persistent vomiting. So this is all about hyperemesis gravidarum. Thank you, students. Have a nice day.
My student support system. Keep watching, keep learning.